Hi, I'm Casey Fry, and with me today is Colleen Sullivan, who is a physical therapist at McGee Rehabilitation Outpatient Center. Today we'll be learning about the profession of physical therapy. So welcome, and thank you so much for being here today. So to start off, can you tell us exactly what is the medical field of physical therapy and what is it that a physical therapist does?
Absolutely. So physical therapists are highly educated, licensed healthcare professionals that can help patients reduce pain, improve mobility, and improve overall independence. And actually, in most cases, physical therapists can help patients reduce the need for very expensive and costly surgery and can prevent re-injury over their lifetime. They teach patients how to prevent and manage their condition, as well as strategies to make them overall more tolerant to their day and more independent. They care for patients in a variety of settings, from a hospital to an outpatient center to home care, as well as a skilled nursing facility. There are even physical therapists who are based within school systems to help patients who have developmental delays or other related issues that impede their education.
So what is the typical education that a physical therapist receives?
So a physical therapist in order to apply to a graduate program, they have had to have already complete a bachelor's program. That bachelor's program can be either in a science or a non-science field, but in order to apply to school, it's required that they have completed biology, chemistry, and other important prerequisites. The physical therapy degree now is a clinical doctorate in physical therapy, otherwise known as the DPT. The DPT program lasts anywhere between 2.5 to 3 years and encompasses a very expansive amount of didactic classroom information, as well as at least several months of clinical experience in the field. Outside of the graduate program, there's advanced clinical residencies and fellowships that physical therapists can complete to further specialize. And those areas can include orthopedics, neurology, sports, women's health, cardiopulmonary, as well as geriatrics. And after a physical therapist has completed one of these residencies, or if they want to further specialize, they can take a specialty certification exam, which gives them a new designation. So for example, if a physical therapist takes an orthopedic specialty exam, then they receive the designation of OCS after their name.
Okay. So can you describe to us how the physical therapist works alongside the physician?
Absolutely. So the physical therapist collaborates with the physician on a very regular basis. Typically and traditionally, a physician will refer a patient to physical therapy for evaluation and treatment, and they provide a medical diagnosis. Then a physical therapist, during their evaluation, develops a PT diagnosis, and what that means is that they're looking at more of the function of the patient, how the patient moves, how their daily activities are impacted by whatever their impairment is, being if it's pain, if it's decreased flexibility, decreased strength. From there, the physical therapist develops a plan of care and collaborates with the physician on what the patient medically needs in order to complete and be successful in physical therapy and help to improve their overall function and improve their independence. There has been a change, though, in the physical therapy world where a physician referral is not always needed for a physical therapist to treat a patient, and that is called direct access.
Okay. So can you tell us what are some of the most common problems that you treat as a physical therapist?
Absolutely. So some of the most common conditions can range from arthritis to low back pain to neck pain, but we can even treat patients post total joint replacement, post-amputation, after they have a stroke, after they have a spinal cord injury, a brain injury, if they're unfortunately diagnosed with Parkinson's or MS or some kind of neurologically progressive disease, but also overall with just deconditioning. So if someone's just less fit than they previously have been, we can treat that as well.
Wow. Okay, so what is the current scope of a physical therapist, and do you foresee that expanding at all in the future?
So this, as you can tell by the number of conditions that we treat, our scope is quite large. So we learn a lot in school, and our primary focus is the treatment and evaluation of neuromuscular and musculoskeletal disorders, which is the very overall, that's how you would categorize those conditions I had just listed. But within those conditions, we can also, though, treat the aerobic capacity and endurance of someone, as well as looking at their integumentary integrity, which means that there's some physical therapists who work closely in cardiopulmonary rehabs. So after someone has open heart surgery or after someone has a heart attack, and they help them exercise in a very safe and monitored way. And in terms of skin, there are some therapists who actually work in wound care. So our scope is quite large, and I think that that allows for there to be a lot of ways that physical therapists can be used in light of healthcare reform. So one area of the physical therapist scope of practice that is often unrecognized by the public is our role in prevention of re-injury or prevention of injury overall, and how we can help to develop a formalized and safe wellness and fitness program for a patient over the course of their lifetime, even after they have a debilitating injury like a stroke or a spinal cord injury.
Okay. So as our population is aging and people are living longer, there's a definite focus on advancing geriatric medicine. So do you foresee the role of a physical therapist changing at all relevant to that focus in that geriatric medicine?
Absolutely. So there's a huge need for physical therapists as the baby boomer generation continues to age. And that is because of the sequelae that happen when someone gets older. So they develop more arthritis. They may require a total joint replacement, or they may have an unfortunate experience where they have a stroke because of elevated blood pressure. And in all of those areas, the physical therapist can help to treat and bring the patient back to as close to their previous level of function. There are many ways that the physical therapist can make sure that a patient ages safely, meaning that if someone is becoming weaker over time, because as we age, we lose muscle mass, we lose strength, irregardless of what we're doing, even if we're being a little bit active. So physical therapists can help develop a more aggressive strengthening program to prevent as much debility developing over time. Another thing that's very common in the aging population is osteoporosis. And by working out regularly and working out in a safe manner, physical therapists can help patients to improve their safety, to reduce their risk for falling. And if they are osteoporotic, that's a very big issue. And it also can make them stronger and help them keep their bones strong. Additionally, physical therapists are really good at understanding how valued independence is to patients. And as we age, one of the patient's biggest complaints is losing their independence. So we can help work with patients develop strategies and safety techniques to make them as safe as possible, which can then make them as independent as they can be in their community and help them believe in their independence and believe in a way back to where they were.
Mm-hmm. That's great. That's a great thing. So earlier you mentioned the concept of direct access, so I was wondering if you could just explain a little bit more how exactly that works and how that benefits the patient.
Absolutely. So in light of healthcare reform, there has been a lot of discussion as to how we can use non-physician healthcare providers to improve access to care. And one of the barriers to access to physical therapy is having to make an appointment to go see a physician, to receive a script, to then be referred to therapy. So the idea of direct access is to eliminate the need to go to the physician to receive that script. And currently, direct access is available in all 50 states. And it's been a very important priority amongst the American Physical Therapy Association. However, in many states, there's different limitations to that direct access. So direct access in each state is governed by the state licensure body as well as the State Practice Act. But generally, the idea is that a patient who has some kind of need for physical therapy could, in theory, walk off the street into a PT office, ask for an evaluation, and be seen without a script. And this does not eliminate at all the need for the physician in the physical therapy episode of care. The physical therapist is trained very rigorously within their DPT program, as well as within continuing education classes that are required for us to keep our license, on how to screen for medical red flags. So if we notice something that indicates that PT is not appropriate at that time because they might have some kind of significant cardiac issue with their heart, or they may have some other fracture or some other neurologically impaired area, then we will refer them back to their doctor and get them the appropriate care. So direct access, the purpose of it is to increase access to physical therapy, serve as one of the gatekeepers of medicine, but know our role, that we are not a physician, that we are looking to help improve patients' access to our services.
Okay, well, thank you so much for being here with us today. We've learned a lot about physical therapy.
Thank you.